We're here today with Dr. Don Middleton, and we really appreciate you being here.
Oh, my pleasure, Kim.
Yeah, and your background in family medicine, and now for the last 7 years working out at the Meadows, internationally acclaimed treatment program out there. So you have a lot of experience, not only as a physician, but in this field of addiction.
Yeah, it's been quite an education. They have some of the heaviest hitters in psychiatric and addiction medicine working out there. It's been real fun learning from them.
Yeah, and we have an interesting topic today. It's something that, you know, as somebody that deals with parents all the time, and as a parent that had to deal with this in my family, I hear from parents a lot of different questions. And it's tough, and these are not all directly related to each other, but they're just consistently being asked by people because, you know, their loved one has got an issue with a substance. You know, they've got, you know, an issue with substance use disorder. They've got an addiction, and, you know, they're coming to like a parent group, like parents of addicted loved ones, and they're trying to navigate, you know, how to be the best parent they can be, how to help their loved one in all of this. But part of it is a significant amount of education that needs to take place, because I know when I was dealing with this, I kind of thought I understood some of this, but then it just seemed like a lot of the things that I started experiencing were not what I thought was going to happen. So, you know, one of the things was that, you know, why do, you know, professionals recommend treatment for the family? Because it seemed like right after our sons got into treatment, they were saying, you need some help too, and you probably should be in a support group, and you might need to see some counseling or need some professional help.
Yeah, that's a great question, because as this person is reaching their end of their rope and about sometimes crashed and burned, sometimes very spectacularly, all the focus is on that person with the substance use disorder, whether it be a behavior or a chemical. But years and years of living with that and the stress going on and the uncertainty and the will he even come home tonight, or why didn't he come home this whole last week, or, you know, did someone steal money out of my purse? Or, you know, there's so much going on that it affects the family. And there's no way that it can't. And to deny that is just, it's going to be an unequal healing. The person's going to come out of recovery with a whole new set of tools, and the family that they're going to walk back into is going to have their old toolbox still. And they need new tools too on how they can deal with it and how they should frame this person's recovery, what they can and can't do, and how to be effective on the things that they can. So getting counseling as individuals is really important, especially for mom and dad, but also for the other siblings. And then some family work is also really important. Just getting to learn how to communicate again with a non-biased person in the room to help like direct while you learn new tools is so important.
Yeah, so I know that being as a parent, as a, you know, somebody that's dealt with this, I know how important it is that if the family is healthy, if the family gets some support, if the family gets to the point where they're responding in a better way to this issue, then the likelihood of their loved one getting the help they need certainly goes up as well.
Yeah, you can't expect to put a person who's just very struggling on their own into an unhealthy situation and that they will thrive. It's like planting a seed in bad dirt. You just can't do it. You need to till and make amend to the soil and make it a good, healthy place for the person to have their best shot at recovery.
And so one of the things that happens is, you know, they get into a treatment program. In my case, my sons ended up getting into a treatment program. And then, interestingly, after my older son got out of treatment, he was out for quite some time from the initial part, and my younger son as well, interestingly, they both got jobs in the recovery field. And I was like, don't you kind of want to separate yourself from that? In my own mind, I'm thinking, maybe it'd be better if you just did something else. Yeah. But could you talk about that a little bit?
Kim, as you know, I'm in recovery myself. I've got 8 years of sobriety from alcohol, and I didn't have anything to do with alcohol treatment or addiction treatment when I was in my normal family practice, other than send people to AA or to rehab. But once you get through it and you're getting your sea legs back and you're feeling good about it, you start to have this question is, why did I go through all that? Is there any way to make sense out of all that? Is there any way that I can leverage the pain and the destruction that I went through in a way that might be of benefit to society, or at least to maybe even one other person? Then it might make some sense. And so when you can get into a place where you can show people empathy and show them love and say, hey, look, I know how you're feeling right now. I know how you're feeling because I've been there. And I'm going to love you until you can learn to love yourself again. That makes all the difference. And that's why you see about 70 to 80% of people in recovery medicine are actually in recovery themselves.
So it's a good thing.
Oh, it's almost mandatory if you really want to do it well.
So I've also been asked this question, are they ever truly recovered? It's done, it's over. Or the other side of it is it forever? It just seems like, you get kind of both sides of it. Like, I need to be in some sort of program for the rest of my life, or, maybe some people are just like, no, I just went to the treatment program, I'm done, I never have to talk about that again.
And as you might expect, the answer is all over the map on that. There are people that go and get sober and say, okay, I get it. Alcohol, bad. Not alcohol, good. And that's the rest of their life. They just don't do anything else. And then there's other people that are attending AA meetings with a 35-year chip in their pocket, and they go 5 times a week, and that's their life. And that's good, too, if that's what they need. Even the AA book doesn't say anything about going to AA forever. It says that this is a spiritual malady, and it's a spiritual answer. And that if your sobriety depends on your maintenance of your spiritual condition. So if you get up every day, surrender to God, say, I don't know where this is going, but your will be done in my life, give me the strength to carry it out, you got a darn good chance of not drinking that day. Now, going to meetings is not a bad thing. Being a social creature, God made us to be that. And we're not meant to live on our own, live in isolation. So there are so many things in this society that alcohol or drugs are part of it, whether it's the bowling team or the softball team from work, So sometimes you have to work pretty hard to find a group of people that are having fun and not drinking or not using at the same time. So for some people, it does serve as their new world, their new community of people. And then there's some other people who just feel called to be there when that person comes in and they're still stinking of booze, and they just say help, and they're called to be that person that says, I got you, let's go. And so that's good for them too. But whether a person has to go to meetings, or that's a completely individual thing.
So another question I hear is, what is this concept of a crossover addiction?
When people would say to me, you have a problem with alcohol, and I didn't have the language to tell them, alcohol is not really my problem. Alcohol is my lousy answer to, I'm feeling uncomfortable in here. I have this sense of unworthiness, and maybe I'm not worthy of God's love, because of the stuff I've done. And good on me if I don't drink, you know, I don't get a DUI and I don't kick the dog or yell at the kids or whatever. But if I don't get healthy tools for this, I'm going to scratch that itch with something else, with gambling or food or buying too much stuff off of Amazon or something. I'm going to, it won't go unscratched. I will scratch it. And so it's real common to see somebody out at our facility. We have a men's sex addiction house. There's a lot of those guys that come into the men's sex addiction house that have a 10-year AA chip in their pocket. And they've gotten physically sober, but not emotionally and spiritually sober. And so we work on fixing the whole package, mind, body, and spirit, so that they can walk away with the healthy tools to scratch at this itch, because you can't make your past go away. Whatever your trauma is or your sense of unworthiness is coming from, that's with you. But you can learn to use meditation and prayer and talking to other people and exercise and nutrition and healthy tools to combat it and to make it calm down and soothe it in healthy ways.
Yeah, and on that same subject, I'll never forget, you know, when we were dealing with this in our family and, you know, with my sons, you know, before we were dealing with hard drugs or anything like that, I just remember thinking to myself, you know, as they were growing up, you know, I didn't want them to ever smoke. I didn't even want to smoke cigarettes, you know, anything like that, because I didn't, and you know, my wife didn't. And so what was interesting is that after they were involved in drugs, well, they got involved in smoking.
Yeah.
And as soon as they got treatment and they ended up actually, you know, getting sober and being in recovery, well, now they're smoking all the time. And I'm like, why are these people not helping them stop that? And I guess the question I hear all the time is, should they just quit smoking while they're there, or should they do one thing at a time? What's your thoughts on this?
Well, here's another place that traditional thought is wrong, actually. The thought is just quit one thing at a time, you know. Go ahead and use your cigarettes and let's just stop the alcohol, and then we'll talk about that later if you want to. But we know for a fact that continuing any compulsive behavior is a problem in recovery. So what happens is let's say I use alcohol and I bump up against my dopamine system and I say, oh, that feels good. And then the next time I do it, but each time it's a little bit higher and a little bit higher to finally where I can't even get to it anymore. I'm not using to feel good, I'm just using to not get sick, right? So take away my medicine, my alcohol, and over time, my dopamine comes back down to where I can enjoy normal things like a sunset or a baby laugh or a really great riff on a guitar. But if I'm doing anything compulsively, like gambling or gaming too much or smoking, I keep hitting that dopamine and not letting it settle down to normal. I don't shoot it clear back up there, but I don't let it come down to normal. So you'll see these people that are 25 years sober and they're still grumpy as can be, and it's because they're doing other compulsive behaviors and not letting their dopamine pleasure system come back, reset back to normal. So we know for a fact that if people continue smoking in sobriety, they have a 30% greater chance of relapse. So we work at the Meadows on getting people like on nicotine gum and stuff, and then weaning down off of that while they're there too, just trying to get rid of all the stimulants and all the difficult compulsive behaviors in their life at once.
Right, and it may not happen right away, but it is something that you think it's important to address it at some point.
Especially stimulants like caffeine and nicotine. We're trying to slow this hamster wheel down. and when you're drinking like a whole bunch of rock stars and smoking cigarettes, it's like taking speed. So,
wow. Another question that comes in pretty regularly is that, you know, well, it's sort of twofold. One is I hear all the time, and I'm sort of smiling because I've heard it so many times.
yeah.
A parent comes into a meeting and they want to talk about their loved one that's got, you know, a substance problem, and the first issue they want to point out is their situation is unique. And when they start describing it, of course, there's absolutely nothing that I hear that I haven't heard, you know, pretty much in every situation.
Yeah.
But a lot of times that that idea of, my situation is different than everybody else's makes it tough for people, because then they think, I don't know, I start to think they start seeing it's really hard for somebody to get better if they think theirs is the only one that's like that. So do you run into that a lot, where people come in and it's like, well, yeah, I understand how you treat all those other people, but you don't understand my situation's different?
Yeah, we call it terminal uniqueness. People feel like they're so different than everyone else that they can't be helped. And it mostly comes from that grandiosity we talked about before, but also from deep, deep shame, that they don't want to really admit that they've got a real bad problem and that they need help. We talk about it all the time in addiction medicine. There's the 5 words that are going to get you killed. You don't understand. I'm different. When you say that, you're saying that no one can help you, that you are just beyond help, and that's ridiculous. That everyone has hope of getting better. It's about surrendering, and it's about submitting one's will to God and asking for His will in your life. But at least surrendering to the program and maybe the fellowship of Narcotics Anonymous or Pills Anonymous or whatever, and at least submitting to that long enough to know what sobriety feels like, not just abstinence.
So one of the other questions we get pretty regularly is, but my son, my daughter, or whoever they're dealing with also has a co-occurring issue, or they think they have a co-occurring issue with a mental illness.
Yeah.
So I'm assuming that's pretty common.
Yes, as a matter of fact, that's why a lot of people start using in the first place, is because they maybe were trying an alcohol drink at the Friday high school football game, but they noticed, hey, wait, I felt normal for a few hours. And so they're self-medicating. And it might be an anxiety disorder or a depressive disorder, or even some sort of bipolar thing that has deeper, mental consequences. So what we call dual diagnosis, the substance use disorder and a different mental illness, those are very common, and because the person started in the first place to self-medicate. So we take away what they were using for their medicine. Now we have to address their underlying core issue, or the other thing that was going on at the same time. So a lot of times people will end up, at least for a while, on maybe like a Prozac or Zoloft or something for anxiety or depression, while they work their way through the difficulties that they've been experiencing in sobriety.
On that vein, a lot of times with this issue of a co-occurring issue or a dual diagnosis, I've also seen where the substance use looks like a mental health issue.
Yeah.
So there could be one, but there also could be what appears to be one. Is that?
Yes. As the brain is affected by the drugs, especially alcohol as a depressant or meth as a stimulant, a person can look like they're manic bipolar, or they can look like they're severely depressed, and we call it dysthymic is the doctor word. But the thing is that often you take them off of their drug of choice and clean up their brain and let their brain heal. They don't need anything at all. So it's real common to have somebody on something right as they're leaving rehab, but over time, the doctor should maybe at least consider weaning down off of it to see if there's even an underlying issue anymore. And often we look at most of these things kind of like as if you broke your leg and I gave you a crutch. So I'm not expecting you to use the crutch for the rest of your life, but it's a really helpful tool for that 6 weeks while you got a cast on. And then, we do other things like educate you on how to, live life without drugs, or do physical therapy for your leg to strengthen it, and then we can get rid of the crutch later on.
So one of the other things that comes up pretty regularly is a question about, my loved one doesn't want to go to treatment. I've talked to them, I've tried to explain to them, they're not interested, they're in this self-destructive behavior, it's awful. I've begged, I've pleaded, I'm thinking I ought to do an intervention. I've seen that. And before I let you answer, obviously a lot of things have happened in that world. It sort of became, some popularity around the concept, and it can be extremely expensive, to actually hire a professional to do that. So I guess the question is, are interventions a good idea? Or is there something to think about if you decide to do that, or what's your thought on that?
Interventions seem like a good idea, okay? We're waiting for rock bottom. So why wait for the person to fall to rock bottom? Why not just bring the bottom up to them and smack them in the face with it and see if you can get them to open up to the fact that they have a problem? The problem is that there hasn't been really good studies that show that interventions lead to long-term sobriety any more than just waiting for the person to do it on their own. That being said, I'm blessed that I have 4 children that didn't have an addiction problem or haven't yet, and we haven't had to do that. I can only imagine if you're watching someone that you love and you care about spiral out of control, you want to do something. And so intervention seems like a reasonable thing to try to do, to at least bring to issue all the different things that are happening because of it and see if you can crack open that defiance that they have, and often it's a very thick wall of defiance. It can be done wrong. It can be done really wrong, enough that the person will never talk to the family again. So it's best to do it with at least a person that's done it before, and a counselor. There's people who are certified interventionalists, and you can either find them online. If it were me, I would think I'd probably look for like a rehab that I was going to take them to and ask them for referrals. Who do you know is successful in getting people in here? And see if that, because it can be done so well and it can be done so wrong and you might only get one shot at it. So.
Yeah, it's obviously it's tough, and families, really have a hard time understanding, really, again, some of this language. And one of the things you just mentioned, and it seems to be a phrase that I'm hearing from people, and people are frustrated with this phrase, and I think part of it is just, how they put it into a context of what they mean by it. And that is you use the words rock bottom. And that goes back a long time. It's a typical, thing people say is like they've got to get to that point where it's rock bottom. Now, of course, if you don't define what that means, then, some people think it, why would you ever want it to go that far?
Yeah.
So when you say that, what's really the concept behind that?
Well, the concept behind rock bottom is this is the place where the pain of continuing is worse than the pain of using. And so I'm finally at a place where I might pay attention, and it might crack open my ego just enough for a tiny sliver of light to come through, and I can see that I need help. Everyone in recovery can tell you their rock bottom story. They can almost 100% of them tell you about that last use and why it was so awful. But the truth is that rock bottom is actually kind of an illusion. If you're breathing, there's another bottom out there. My rock bottom didn't include incarceration. That's waiting for me if I were to drink again. I didn't get shot by somebody that was angry at me. I didn't run my car into a tree and lose a limb. There's a lot of bottoms waiting for me out there if I just pick up again. And that sounds really depressing. But on the other side of that coin is the good side. If you're breathing today, God's still got a plan for you. And so there's a reason why you're alive and kicking. So there's hope for you and a better life and a reason to keep waking up in the morning and jumping out of bed. So rock bottom is that jumping off point for a lot of people, but it is there's always a deeper bottom out there as long as you're alive.
And I think the concept is that if you take that to the extreme of saying that means, that it has to get so bad or it has to get this, but it's relative to the person.
Yeah, there's a lot of people what we call like high bottom people. Like they still have their house and their car and their job and their family.
So they didn't have to lose everything.
They didn't have to lose everything, but they were maybe threatened with losing everything. Or they could see that if they kept doing what they were doing, they were going to lose everything. So it has to be pretty substantial because the desire to use is become essential for survival in the person's brain. And it's been rewired to think, this is how I will survive. So it has to be pretty substantial to tear them away from that.
And I just recently heard someone say, they really didn't like that concept, especially in today's world. And they put it around the issue of what's going on with fentanyl, and saying, well, when you talk about somebody needing to, hit rock bottom, well, one use and they could be gone.
Yeah.
And of course, when I heard that, I was thinking, I think we're talking about two different things here.
Yeah.
Because at some point, somebody has to have some experience that will trigger in them the desire or the interest or whatever you want to call it to get some help. And on the other hand, you have this potential of drugs out there that now, one use, and that may be the last one.
Yeah, fentanyl's changed a lot of the rules, and we don't even know how it's changed them in some ways. It's becoming it's in everything now. You can't buy cocaine without fentanyl in it. You can't buy even a pill. They press it into pills that look like OxyContin and look like Percocets. And so a kid will come into our facility and think he's addicted to Percocets, and we'll urine test him and say, man, you pop negative for Oxy, you're on fentanyl. And it's a really awful withdrawal for him. But as a disease, addiction has in its symptoms defiance and grandiosity, which seem really weird, but the two of those things are common symptoms. And just telling a person, well, this can kill you, they're going to say, just like every other young person in the world, yeah, but I'm different. And that's what we said before. You don't understand. I'm different. And that's what kills us. And it's very difficult. Now, out of love, you're going to be educating and talking and bringing other people into the picture and maybe even a true intervention. But in the end, they have to surrender and not just submit, surrender.
And so how do we, or any ideas about prevention? I guess I wanted to say, how do we prevent them from doing it? But I guess maybe it's more, do we have any ideas that are hopefully helpful for people to kind of prevent, their kids from going down this road?
The only thing that seems to make any sense to me is to look at why people use in the first place. And the most common reason is to soothe themselves for some discomforting thing. The most common one I see as I talk to hundreds and hundreds of people in addiction is they have a sense that they're unworthy of love and they're unworthy of respect. And whether that's from some major trauma in their life or from little micro traumas of people saying, what's wrong with you? How come you're not as good as your brother? Or, like over and over and over and over again through their life, that they have this sense of inferiority. And so that goes away for a few hours when they smoke weed, or it goes away for a few hours if they get drunk. And so teaching children to soothe themselves with something that's healthy, to talk about their feelings, to try to be aware of how what we're saying to them isn't helpful and maybe even harmful. I think that's our only preventative, because we're not going to stop drugs from being around. It's a supply and demand thing, and as long as someone's wanting it, there's going to be people selling it. But we can stop the demand by giving our children better tools to self-soothe. And we're teaching them to pray and to ask God for help and for comfort, and to talk to other people about their feelings when they're feeling strange and don't know why, or to treat their body with respect for exercise and nutrition and sleep and things like that.
Well, again, a lot of different questions that come in all the time, but really appreciate you taking a few minutes and talking about all of that. So thank you again.
It's my pleasure, Kim. There's no more important topic in our society right now.
Thank you.
Yeah.